Hello there, everybody, and welcome to this edition of Cancer Prevention and Wellness. This is a monthly program sponsored by the Cancer Survivors Park Alliance. I am your host, Jeff Jagger. This month, we are pleased to be joined by Dr. Rocky Nations, an assistant professor of biology at Brevard College in Brevard, North Carolina. Dr. Nations is going to be speaking to us about the therapeutic benefits of nature and more actively gardening or horticulture. Um, Dr. Nations, welcome, and tell us a little bit about yourself and your journey to get you to this space, which we feel has definite applications to our cancer survivor population as well as to the general population of the upstate. So welcome.
Thanks. It's great to be with you. I appreciate the opportunity to talk about a couple of things that are definitely part of my personal and professional journey. Um, I have a little bit of introduction in one of the first slides, so if it's okay, I'll go ahead and
Everybody wants to know if Rocky's your real name.
yeah. So that's always a good thing to start off with. Rocky is not what my mother named me. It's a nickname I picked up really early. It stuck for better or worse, and am known in more formal circles as Travis, but all of my friends and family know me as Rocky.
So your publications are Travis.
Correct. Yes. Yeah. Um, I've titled this Gardening for Health, Wellness, and Stress Management. And just to give you a quick overview, I'd like to start with some just themes and threads, a little bit of background, and then we'll move to stress management, resilience, and the therapeutic value of nature. And then we'll wrap up talking about the relationship between gardening and wellness, sort of an extension of this therapeutic value of nature. So to start with some themes and threads, I grew up in the upstate of South Carolina. I can't remember not enjoying being outdoors. I always found being in the woods comforting. It was a place that I sought out um, through childhood, adolescence. It became very important when I was in college as a study break, a place to get away. Uh, Very fortunate to have access to a lot of outdoor resources in the area. So nature and being outdoors has been important to me for a really long time. Um, so fast forward a little bit, I have been in education for over 30 years, about 23 or 24 in higher ed. And several years ago, I started to notice an interesting trend. A lot of students, a lot of my college students just seem to be really stressed. And this was even pre 2019, 2020 pandemic. There just seemed to be a rising level of unrest and anxiety, uh, stress manifesting in a lot of different ways. And I was very intrigued by that. In addition to that, if you look in other areas of research, you know that it's not confined to college students. Working adults have been reporting higher levels of stress and work dissatisfaction, and it comes out as burnout in many circumstances. So I just became really interested in that for a lot of personal and professional reasons. And one of the ways that uh, started to bear some fruit is I created a course. At the time, I was teaching at Anderson University, and I developed a course which was basically nature-based stress management. nature-informed stress management, and I taught it several semesters there. I'm now teaching it at Brevard. I continue to teach it at Anderson as an adjunct. Both of these are courses that are part of the general education curriculum, so students have an incentive to take the courses because it checks a box toward graduation. But what I found is that the course has been really resonant, and students seem to be really interested in talking about stress and definitely the therapeutic value of nature. So the courses have become very popular, and demand is pretty high. So uh, I'll just give a brief rundown of the course, and that'll be a segue into the topic of nature and gardening. So in this course, Nature Informed Stress Management, a lot of students come in thinking, well, the goal is just to eliminate stress. That's what we need to do. And I quickly try to point out that that's not the goal, and it's not even possible to eliminate stress. So what we want to do is manage stress. Stress is universal. I heard somebody recently say that stress is the price of living a meaningful life. That if you're living a meaningful life, you're going to have stress. So at the heart of stress management, and you see this word a lot of places, is resilience. So resilience can be defined many ways. It can be defined as the ability to mentally or emotionally cope with a crisis, to return to pre-crisis status pretty quickly. Some psychologists would say, in some cases, you return to an even better state. You experience growth from these things. One of the best analogies for resilience is a spring. A spring has a certain shape. It experiences a force and can become deformed. But once the stress is, or once the force is removed, it returns to its previous state. So resilience is a very popular buzzword concept when it comes to managing stress. Another way of looking at it is it's the capacity to recover quickly from difficulties and toughness in the face of adversity. So I think a lot of students, arguably a lot of adults, think that the goal is to avoid adversity. And that's just not possible. Adversity is going to find us, and being able to cope with it and deal with it and manage it uh, goes a long way in helping us be more resilient and managing the stressors that we experience. So in this course, I have created a model and a framework for articulating resilience and how to cultivate resilience. And drawing on my background in ecology, I'm an ecologist, an outdoor biologist by trade. Um, Using the analogy of ecology and a healthy ecosystem has become a really helpful way to present the concept of resilience. So in ecosystems, you have a variety of components. You have plants, you have animals, you have microorganisms. And one of the hallmarks of a healthy ecosystem is all of the connections that take place. So you have structure, but you also have function. And healthy ecosystems have a variety of resources and connections between and among all of those resources. So as I did a lot of study and deep dives into the concept of stress and managing stress, there just started to be some common themes that seem to be connected. And we're resilient people. We have the capability of resilience, just like healthy ecosystems do. So I created this concept, like I said, of the ecology of resilience. It has three content areas, three domains, if you will. I think it's important to point out that when it comes to managing stress, there are a lot of external factors that we really don't have a lot of control over, but there are a lot of internal factors that we do have agency over and that we can control. And the important take home from this is we need to focus on those internal things that we do have control over and not worry so much about the things we can't control. So all of these things that we talk about to some extent are within our own control. So these three domains that I try to fit things into include understandings, knowledge, if you will, practices, helpful practices and skills that you can learn and do. And then finally, connections. And I'll elaborate on that as we come to a close in just a second. But let's talk about understandings to start with. I think it's really important for everyone to understand what stress is. And the standard definition of stress in psychological circles is we experience stress when our perceived demands and risks, things that would enhance stress, when they outweigh our resources to handle the demands. And when we perceive an imbalance between those two things, then that engages our stress response. So there are a number of things that can be perceived as demands in our lives. Um, Work for sure, relationships, finances, responsibilities, our health, an unexpected diagnosis, surely can start to tip the balance toward the stress response. And there are many other things. So normally we have a balance between the demands and our abilities to handle the demands. This would be a type of homeostasis, and that's sort of the default setting that we have. So whenever these things start to um, accumulate, that can start to tip the balance towards stress and fatigue. I've color coded these different directions. And I would argue that stress and fatigue are actually still sort of in the green zone because they're typical. They're normal. It's normal to have a little bit of stress, and it's normal to get tired and have a little bit of fatigue. However, when they continue to accumulate and get heavier and heavier, that can tip the balance more toward overwhelm and burnout. And then finally, if they get really heavy, then that can tip the balance toward um, collapse and just not being able to handle all of the things on our plates. So the goal in managing stress is to understand this relationship. And then um, one of the things I try to do in this course is introduce resources that can tip the balance back the other way. Practices, things that you can implement that will provide some ballast in the other direction. So I won't go into great detail, but some of these practices include exercise, diet, sleep, getting enough rest, having uh, leisure things that you enjoy doing, practicing gratitude, journaling is a big practice advocated by a lot of counselors and therapists. Um, Having relationships, opportunities for service, and meeting needs of other people as well as our own, practicing mindfulness, meditation, prayer, um, having some self-awareness of our own emotions and strengths and weaknesses and blind spots and things like that, practicing authenticity, being our true selves. All of these practices can be really helpful in providing that balance that we need between demands and resources to help us manage stress. So there's one other practice that I uh, can't help but include, and this is a big focus of the class, and that is nature and spending time outdoors. And like I said earlier, I've known for a really long time that spending time outdoors is good for me, and I get a lot of value from spending time in natural areas. And I think that's true for most people. What I didn't know at the time when I first started teaching the class is that spending time outdoors for the therapeutic effects actually has a name, and it is referred to in some circles as forest bathing. And this is not a new idea. It's actually a very old idea. A lot of Eastern cultures have been practicing this type of thing for centuries, if not millennia. And it's basically just the idea of spending time in nature and combining that with mindfulness and paying attention to what you're seeing and hearing and touching and smelling, and then reaping the benefits from it. Um, this is a well accepted practice in Japan, and they have a name for it, Shinrin Yoku, that literally translates as forest bathing. And I get a little bit of pushback in using that term for people that aren't familiar with it or from them. But if you think about it, spending time outdoors in the forest, you're surrounded by air, which is a fluid. And just like with water, there are eddies and there are currents and there are waves and tides. And we're literally bathing in several different stimuli in a forest. And what researchers have found is that this can be very therapeutic. And this practice gets a lot of attention and is just in the last 5 or 10 years been getting the attention that it deserves in Western cultures. So there's a classic study uh, in that relates to forest bathing and the therapeutic value of nature. This is sometimes referred to as the view through a window study. It was conducted back in the late 1970s and early 1980s. It was conducted by Roger Ulrich, and he studied patients recovering from gallbladder surgery in a Pennsylvania hospital. And back in the 1970s, gallbladder surgery was still a pretty major surgery, extended recovery. And he studied the patients that had this surgery and were in the recovery ward of the hospital. Well, as it turned out, this recovery ward, the rooms, roughly half of the rooms had a window that looked out at a brick wall, and then the other half of the rooms had a window looking out to a wooded pastoral scene, so nature. And he was interested to see if there were any differences in these patients and how they recovered. And these were the two groups in his study, and he found that the patients with the view of nature had a shorter post-op stay. They had fewer requests for pain medication and fewer complaints about their care. All very important metrics from an outcomes standpoint in healthcare and healthcare management. So this became sort of a seminal study that led to the advent of the therapeutic value of nature as a formal discipline. And since then, there have literally been hundreds and hundreds of studies that have looked at the therapeutic value of nature and spending time outdoors. And they find positive effects on everything ranging from heart rate and blood pressure to stress hormone levels, pain, brain activity, anxiety, depression, and then most importantly, possibly in the context of talking about diagnoses and cancer and cancer treatment, is that spending time in natural settings has been shown to have a very positive effect on immune function. A positive effect on these immune cells called natural killer cells, a decrease in inflammation, and there are just a lot of positive directions that this line of research has taken in recent times. So, in addition to all of that, uh, that we have gardening, and gardening is a logical extension of spending time in nature, and it's literally a hands-on way to experience nature and all of its benefits. So, I've more recently been interested in the research literature that suggests that gardening can be therapeutic. And we're not going to do an exhaustive list. I'm just going to mention a couple of the studies that have come out in the last several years. This is one that found a positive relationship between community gardening and well-being, an increase in resilience and optimism. This one looked at a gardening program in an elderly care facility and found positive results for depression and anxiety, an increase in life satisfaction, vitality, and decreases in loneliness and stress. This is a meta-analysis, a study of studies, sort of a summary of many studies that have been done in this field. And they found that gardening was linked with higher life satisfaction, quality of life, and also sense of community. So again, anyone who's interested in these studies can look these up and see the details. One that I ran across really recently that came out about 10, 11 years ago was actually in an architecture journal. And this article was reporting on the positive effects of a therapeutic garden that had been created at a cancer treatment center in Cleveland, Ohio. And this is a really interesting take on the value of having access to nature, even if it's in an urban garden setting. The therapeutic benefits can be pretty widespread, and this has actually become a common theme in cancer treatment facilities, and many of them are seeking to create these green spaces in-house or adjacent to their facilities, just so that patients and families can have access to these. Dr. Jiguer, I was interested to see if you had any experience with this type of thing in the design of of treatment facilities.
Yeah, no, we actually the Clemson landscaping students had a great deal to do with the healing garden in the pediatric cancer space at Greenville Memorial Hospital. And closer to home, given the fact you live in Seneca, we have a cancer institute in Seneca that we are looking to renovate and expand. And an aspect of that expansion and renovation is a healing garden space that is directly located off the chemotherapy suite with windows looking out, but there's also the ability for people to go out and walk through it as well. So yeah, it's a common theme that is becoming more popular as the science backs it up.
Yeah, that's interesting and exciting to hear. Again, one of the other take-home messages from this is that in addition to the therapeutic value of spending time in natural settings and outdoors, that there are degrees of it. And this doesn't necessarily have to be a wilderness setting. It can be an urban park setting.
Right.
It can be a garden. It can literally just be um, being able to see pictures of pastoral scenes. And I've noticed in a couple of hospitals that I've been in that the interior design folks have included a lot of pictures of woods and waterfalls, which I think is an interesting and appropriate approach. So as we wind this down, you don't have to look necessarily at the formal scientific research. You can literally just go on the web and search for things like therapeutic value of gardening, nature therapy, healing garden, and you get hundreds of hits of articles that are written for popular consumption, not necessarily scientific consumption. And many of these um, illustrate the value of gardening on various aspects of health, whether it's mental health, um, immune function, all sorts of things. There's one that in particular interests me, just the value of soil and being able to handle soil and some of the smells and textures that seem to have a therapeutic approach. So again, the take home message seems to be that gardening can be good for you, just like spending time in the woods. There are definitely some health benefits of gardening. So to bring this full circle, talking about ecology of resilience, um, the third domain in this ecology of resilience framework is connections and making connections. And connections involve um, in connections at many levels. One of those is connections with other people. And there is a lot of attention paid in therapeutic circles to trauma and recovery from trauma and PTSD, post-traumatic stress disorder. And one of the things that psychologists and clinicians have found is that not everybody that experiences a traumatic event develops PTSD. It's actually a fairly small percentage. So the question becomes, what about the people that don't develop PTSD? In some cases, many actually experience what's called post-traumatic growth, and they end up in better spots than they were before from their experiences. So the question becomes, what are the predictors? What are the things that can predict post-traumatic growth versus post-traumatic stress disorder? So a lot of attention's been paid to this. This is manifested in an approach known as trauma-wise care, and there just seem to be some common pillars and threads of this. They include safety, personal and immediate safety, um, coping, being able to express emotions, being aware. But one of the single biggest predictors of post-traumatic growth is connections and having a positive social support network and having meaningful social connections. That seems to be one of the most important factors when it comes to dealing with stress and troubling diagnoses and trauma. So that's the third element of this approach is making connections with other people and then also making connections between and among all of these different resource groups, the practices, the knowledge, the understanding, the appreciation. So when it comes to creating this healthy ecosystem of structure and function, one of the interesting things is that the gardening checks a lot of those boxes. It provides opportunities for helpful practices. It provides opportunities to connect with other people. There are other therapeutic aspects of it. So gardening is just a really interesting tool to include in the tool belt for improving health and wellness in various circumstances and scenarios. I do like to add an asterisk anytime I talk about stress and stress management and the therapeutic value of nature. And that asterisk is simply this isn't a cure-all. It's not necessarily a cure. It's not going to cure cancer. It's not going to cure um, mental health diagnoses. However, it can help and it can supplement. And when it comes to balancing out that stress ratio, gardening can be a really important factor to include to tip that balance back in a positive direction and get us back toward health and wellness and away from overwhelm and burnout. So it ends up just being a really interesting uh, piece to the ecology of resilience approach. And again, I thank everyone for the interest in this topic, and I think there are tremendous opportunities to explore in the future for experiencing the therapeutic value of nature in the context of gardening. So,
Yeah, thanks. That's a lot for us to chew on. I think there's also some benefit to growing your own food. I mean, one of the basic pillars of lifestyle medicine is nutrition, and it's plant-based. And what are you growing in your garden? But vegetables and fruits, and but there's something even more satisfying about putting it on your plate, having it being in your garden that morning. So I think that's part of the stress management too. One question, I am sure you've studied this and asked questions of your students, but you made it clear that it was a pre-pandemic um, aspect that they were having more stress. What is your hypothesis or hypotheses as to why that's occurring? In our population, I mean, clearly they've just been faced with a potentially fatal diagnosis and the unknown of how treatment's going to affect them and their families. What do you think is going on with these younger people?
yeah, I'm not a sociologist nor a psychologist. A lot of my experience is purely anecdotal and experiential, but I tend to think that one of the things contributing to this trend and phenomenon is just the rise of social media. Social media has a lot of virtues, but a lot of the social connection that comes about through social media is very artificial. It's very surface level. It's not one-on-one. It occurs sort of in a vacuum, and compounding all of that is it just creates opportunities for comparison. I've been taught all my life that comparison is the thief of joy,
All right.
and
Right.
and nowhere else is comparison rampant than it is on social media,
Right.
and you see a sanitized version of everybody's realities, and you come to think that, well, everybody else is thriving and winning, and I'm not. Um, it has definitely led to a decline in one-on-one, face-to-face conversations. It's not uncommon to see people in restaurants on their phones, on
Yeah.
their devices, and I think it's probably a number of things. I think the rise of social media has contributed definitely to a rise in stress and perceived stress.
Well, you see families around the table at a restaurant and nobody's talking to each other. They're just, looking at their phone. You've been teaching this class at a couple of institutions for a long enough time and, have touched a number of students. Have you looked at any metrics of before and after as far as stress?
I have, and I didn't include any of those data in this just to not get in the weeds too much. But in the course, each semester I teach it, I give a couple of surveys at the beginning, and they include just general questions about stress and lifestyle and perceptions of stress. A couple of formal instruments I use are the perceived stress scale and the brief resilience scale. So I collect before and after pre-test, post-test data on these students, and then also in the past I've used a control group of students who are not in the class just to see if there's a difference. And what I've found is that in the students that take the class, there's a positive change in before and after on both of those scales. And in the control group, they pretty much stay the same. So perceived stress and resilience tend to improve after taking the course.
So you've got probably a statistically significant number of people who've taken the course. Is that publishable, or have you already published it?
It is. It actually was just published in the fall of 2024 in the American Journal of College Health. And it is available online. I probably could have included a link to it, but that seemed a little too self-serving.
No, we're okay with that.
So
It's
the
okay to toot your own horn.
yeah, so it's yeah, I think I misidentified the journal. It's the Journal of American College Health, one of the fall 2024 issues. And the article is Ecology of Resilience,
That's great.
the title.
Congratulations.
Yeah, thanks.
So one of the things Dr. Nations and I talked about before the presentation is that in our unique group of cancer survivors, one of the things that makes soil from dirt is that soil's got a lot of organisms in it, and that's important to the growth characteristics of soil. But it can also be harmful to some of our patients who are more immunosuppressed. So I just make sure that you're talking to your doctor if you're an avid gardener, especially if you're going through chemotherapy that may be depressing your white count. I have had the experience of a patient with a disease that is familiar to many of you called multiple myeloma, where they are just via the disease immunosuppressed. And she developed a couple of pneumonias that we could identify organisms that might have been from her gardening. And she had to kind of stop putting her hands in the soil. She still is very active in gardening, but not in the actual planting and harvesting and weeding and that sort of thing. One of the other aspects that I think we need to point out is that nature, when you're in it, it sometimes teaches you resiliency. I mean, there's always those photos after a forest fire where, the green shoots are starting it's the normal cycle of nature. Sometimes it has to get destroyed and nature being resilient, it comes back. We always see those pictures, even in urban settings, of a flower coming up between um, the connection in a sidewalk. We've obviously everybody in the upstate experienced the natural event of Helene this fall, and our park, uh, because if it wasn't on a floodplain, it would probably have buildings there. So we're in a floodplain, and the Reedy runs through it, and so much rain in so little time, a lot of our park flooded, including the Healing Garden, which is a garden that was very thoughtfully planned with native plants to this area. And it has colors blooming throughout the year, different seasons bring different things into bloom. But for 24 hours, our healing garden was underwater. And I predict that once it starts being a little warmer, we're going to see that a lot of those plants suffered the trauma of that flooding and are going to come back whole and bright and shiny. So, it is a lot of things that nature does that are part of the basic pillars. Since I've known Dr. Nations, we've talked a little bit more about lifestyle medicine, so he's being more interested in that, and hopefully he'll join the American College of Lifestyle Medicine and even potentially become a diploma or even get certified, because there's so much of nature that fits the pillars between stress reduction, obviously, mind body. You emphasize the social connections, the nutrition about growing fruits and vegetables, and the exercise. Gardening is digging and hoeing and cultivating, and there's some increased heart rates that go along with that too.
Absolutely.
Uh,
And just to touch briefly on one thing that you said, in addition to the therapeutic aspects of nature and being outdoors, there are a lot of lessons that we can take from nature, a lot of analogies and metaphors. Disturbances happen, fires happen, floods happen, and that's true for us too. The metaphorical floods and fires. We get sick, we get diagnoses that weren't expected, and it's just the way of life, the way of nature. That doesn't necessarily make it easier, but it is somewhat comforting in knowing that, yeah, this is one of the aspects of being human is these things happen, and we do have the capacity to overcome and demonstrate that resilience and in some cases be better for it.
yeah, well said. And well, listen, thank you so much for a very thoughtful presentation. I appreciate you putting together well thought out slides, and it was a very rational argument for all the things you said. So thanks so much for spreading the news with us, and we'll get back to you with the metrics as to how much of an impact you're having with this series. So thanks again.
Yeah, thank you so much.
So one of the things that we do this every month, and we record these sessions every month. So if you want to go to the Cancer Survivors Park website, that's cancersurvivorspark.org. There's a whole library of topics like this. Sometimes we talk about the cancers, we talk about vaccines, we talk about genetics, but most of the time we're talking about lifestyle medicine and how you live your life through a cancer diagnosis and beyond a cancer diagnosis, and maybe the stress produces instead of a syndrome growth. And so we try to give you the technique so that it gives you growth. As is our practice, we end with a quote. This is from Pico Iyer, Iyer, who is a English-born author. He basically writes about a lot of travel books, but I think this speaks to a little bit of the passive aspect of nature. And he wrote, "In an age of speed, I began to think nothing could be more invigorating than going slow. In an age of distraction, nothing could feel more luxurious than paying attention. And in an age of constant movement, nothing is more urgent than sitting still." So hopefully everybody stays warm, and we will see you in a warmer month of March for our next topic. And thanks for visiting with us. Thanks, Dr. Nations.
Thank you.